Lower back pain can be debilitating, but today I'll expose two culprits that could be standing in the way of your recovery. Don't go anywhere. So lower back pain can be a disruptor of daily lives, and there's so many causes, which makes it difficult to solve. Could be just repetitive things that we're doing on a daily basis, like sitting for long periods, which disrupts the blood flow to the muscle tissue. Could be excessive lifting, a herniated disc. How about trigger points? Those tight muscle fibers that create lots of pain and can even refer pain elsewhere in the body when compressed. It can be an accident, sciatica, the sciatic nerve in the lower back that radiates pain all the way to the foot. And the list goes on and on. But whenever we have lingering pain, we know there's a problem, but we have to figure it out. Sometimes we miss the mark because it can be complicated. Let's see why. So trying to figure out why our pain is lingering can definitely be complicated because we could be having pain in one area of the body, but the problem is originated from somewhere else that's compromised or injured. This is called referred pain. Here's an example. Someone could be having a heart attack, but they're only getting pain in the jaw, or even pain radiating down the shoulder. So, could this be the reason why so many people have unresolved lower back pain? Because they're only focusing on treating the back, not knowing that the pain could be originated from somewhere else? If it is, the lower back pain will not go anywhere until the area that's compromised and referring the pain to the lower back has also been addressed. So this takes me to the two culprits that could be referring pain to your lower back. Let's see. So before I get to the two culprits, let me give a brief overview of how muscles work. Every muscle has two ends, where it originates and where it inserts. Now both ends have tendons that attach them to bones. Now the origination end is more stable compared to the insertion end that has more range of motion. Now muscles on a whole, when they get tight and stiff, the fibers shorten and they can pull bones that they're attached to out of alignment. Now activities like these can create major problems for other attached body parts. So this takes me to culprit number one, the lower extremities. Now the lower extremities, when these muscle groups get tight, they will pull on the lower back muscles, and they will also pull on the muscles in the knee. And this will create major pain for both areas, the lower back and the knee. So let's go to culprit number two. So culprit number two is the Quadratus Lumborum muscle, QL for short. Now the QL muscle is the deepest muscle in the abdomen, but it can only be accessed from the side of the torso. Now it's on both sides of the lumbar spine. It stabilizes the pelvis and it also supports the core when standing. Now the QL muscle has many different responsibilities, which comes with many different problems. It can create pain in the entire back. Now when the muscles get really tight, it can actually pull the hip upwards, which creates a tilted pelvis. And tilted pelvis will create imbalance in the body. Any imbalance in the body will create pain. It also supports squatting. So whenever you have any problem squatting, you can put some blame on this muscle. So both muscle groups can create major pain in the entire back, but they're always overlooked, but should never be ignored. Let's move on. So now that you're equipped with all this information, what will you do? You can take some action, get some help. But bear in mind that lower back pain can be a result of so many other health issues. So before you indulge in any self-care, speak with your healthcare provider first and let them decide if it's okay for you based on your health conditions. Now, massage therapy can be a great start. Massage can loosen up those muscle fibers. get oxygenated blood and nutrients in the muscle tissue, you feel better right away. Now, the foam roller can be your very best friend. The foam roller can target problematic areas in the body. The arms, the legs, the back, with caution, of course. The foam roller can loosen up those muscle fibers and get oxygenated blood and nutrients. You feel better just the same. Now, stretching is essential for all muscle groups. Now, the QL muscle can benefit from side stretches since it's on the side of the torso. And there's so much more you can do. Yoga, Pilates, anything to elongate those muscles and get them nice and relaxed. Now, just remember, when the muscles are tight, it's difficult for the blood to flow in. But when it's nice and relaxed, like after a massage, the blood just goes right in and make you feel so much better. So if you're having unresolved lower back pain and you have exhausted all of your options, maybe it's time to look somewhere else. Maybe you should check to make sure these two culprits are not in the way, because they could very well be. So this is all for today, folks. If you have benefited from this video, please let me know in the comments below. And please subscribe to my channel to get more videos like this. Thanks so much for watching. Cheers.